goes on in order to reduce the risk of complications,
Mm.
from pregnancy, because pregnancy is highly demanding. It's a highly demanding physiological condition. So you
Conditions.
want to ensure that you are fully prepared. Remember, failure to plan is also like
Yeah.
planning to failure.
Okay,
Yes.
so we'll take it a bit further.
Yeah.
So I know that sometimes when we hear pregnancy, they look towards the woman. So
Yeah.
maybe we should talk a bit about what a man should be doing when he's looking forward to having a child, and what a woman should be doing when she's also looking at getting pregnant. I want to get pregnant. What should I be doing before then? Or
Yeah.
why trying? As a man, what should I be doing before then? So we'll talk a bit about that.
All right. It's beautiful that you had to bring in the man, because oftentimes when we talk about fertility, the focus oftentimes is on the woman.
Mhm.
But studies have shown that infertility cases, about 35% has been related to the male factor, and that's quite a significant number. So for the man who intends to have his children, okay, he has to maintain a good weight, he has to eat healthy, he has to observe a better lifestyle, exercises. For someone who takes alcohol or smokes cigarettes, you want to minimize that, if possible, eliminate it completely,
Mm.
because the well-being of the man also affects the fertility
Mm.
generally.
Yeah.
Then for the woman, which is why some of the things we'll be discussing furthermore.
Yeah.
She also has to maintain a healthy lifestyle, balance, have a good balanced weight, and also some supplements which we always get to remember. I don't know if I should start saying that now.
Well, we'll eventually get there.
All
Yeah.
right, all right. By and large, a healthy lifestyle, yes, just before conception.
So you guys hope we are noticing that as much as we're talking about supplements, we have a lot of people that consume a lot of herbs. I'm sure that Dr. Faith will take us there
Yes.
when we get to the point of what to be taken. And yes, it's important to note that this session is not to by the time she's now saying supplements, possible supplements, I'm sure she will not call them as drugs. Maybe she will call the content so that you don't go and buy it and say Dr. Faith said we can take them. Yes,
Absolutely.
viewers, it's all the whole goal of this session today is to see that while you're trying to conceive and eventually achieving conception, you are bringing forth a healthy offspring, and then you as a parent will also be healthy, because it's good when both parents, both mother, father, and
Yeah.
baby are fine,
Yeah.
and not the other way around. Your baby is fine and the same mom is still in
Yeah.
coma or something like that.
Yeah.
So that's why we deem it fit very, very essential to talk about this session today. So I want to talk a bit about weight, because I know you
Okay.
mentioned about a healthy weight.
Yes.
So what role does weight play with respect to conception for either the man or the woman? Generally speaking, what weight does role play? What are things that overweight can actually predispose people that are trying to conceive to, even when they've actually achieved conception?
Yeah, amazing question. So when we're talking about weight, it's not in isolation. The standard parameter is the BMI, which has to do with both weight and the height of the person. So for a normal weight, we are looking at 18.5 to 24.9. So less than that is underweight, and above that is overweight, and then over 30 BMI. The BMI is termed as obesity. So either sides of the extremes, either underweight or overweight, tends to affect, fertility, and also poses a threat to the developing child if eventually such people are not properly evaluated and they get pregnant. The child is predisposed to coming down with birth defects. The woman is predisposed to coming down with complications like preeclampsia in cases where the hypertension is not controlled, diabetes mellitus. For those who are not even, who may tend to develop it in the course of the pregnancy, that's gestational diabetes. So all of this risk, and then underweight for individuals with eating disorders like anorexia nervosa, it affects ovulation. Some of them may even find it so difficult to even conceive because it tends to affect the regulation of hormones and eventually ovulation and fertility. Yeah.
Wow, a lot about weight. Now, hearing all these that Dr. Faith is talking about, it just makes us know that you have to have a healthy weight.
Yeah.
While you were talking about this, I actually remembered sometime last week Friday. I think I remember Dr. Kem talking about weight. How sometimes you see men looking so big.
Yeah.
I mean, yes, sometimes it seems like we want to talk more of the woman trying to lose weight, and then you see some men that they can barely walk.
Yeah.
And then it's actually not good looking. Maybe for the woman we can even manage, but then coming to see a man that is looking all big, and then they're not doing anything about it. And maybe it's the woman, they're always looking at the woman, your weight, you're trying to get pregnant and all, but then the weight also affects the man's sperm.
Yes.
So if that affects the sperm, then why should you keep the weight if you are trying to get pregnant? Why wouldn't you cut down some of the things that you do? I mean, Dr. Faith, you seem like you want to say something about it.
Yes, it's important that we also emphasize about men having good weight, because it affects the quality of sperm, and low sperm quality also affects the developing child. They are predisposed to chromosomal abnormalities. So it was a good thing that you highlighted that. Yes.
So it means that weight is not good for either of the partner. Sometimes the man will feel like it's sperm, I have sperm, and then it's you that need to lose weight. It's you that's trying to get pregnant. You will get bigger. If you are big like this now, how will you be when you're pregnant? Such thoughts for the woman, and then the man is just living recklessly, feeling like the weight has nothing to do with him. It's fine. fine.
It has
But then
everything to do.
exactly, if you're
Pregnancy is teamwork.
so yeah, it's
Teamwork.
yes, and even now research has shown that fertility male factor is even getting to about 50%,
Yeah,
affecting what's it called, pregnancy, fertility, and all of that. So it means that as a man, you play a vital role too
absolutely.
with respect to fertility. And so you don't leave the burden to the woman to just say it's her thing. Allow her do it, and then when it's time, some men will even say, when it's time, just tell me, so that like and that's not the best. Like Dr. Faith has let us know, it's a teamwork. The woman cannot get herself pregnant
Yeah,
except by virtue of maybe getting donor sperm through an IVF treatment.
yeah.
But if she's going to do it as a couple thing with you, of course, it means that your sperm.
Both
And
parties.
sometimes, oftentimes, you hear some women saying, "Talk to my husband, tell him to. He's drinking too much, he's smoking too much," and maybe they've complained that his sperm has issue, but he doesn't even care. He
Yeah,
just seems to continue with his lifestyle, not minding what. How about those people that even take drugs, some medications that they take?
yes,
Well, I know that there's a lot that Dr. Faith will tell us more, but we're just trying to let us know this is just a part of it. We're talking
yeah,
about weight, a part of it, and Dr. Faith has let us know part of the things that can actually affect it. So sometimes too, even in the course of couples trying to conceive, some of
yeah.
them have trouble with understanding their menstrual cycle.
Mm,
Sometimes you can hear question like a woman asking, when is my fertile period? When am I supposed to meet my husband? So how do they even get to understand what their fertile period? Let's even be sure that they are even meeting the right way if
yeah,
they are trying to conceive.
yeah. Beautiful question. So it's postulated that for a woman who gets to have regular menstrual periods, it's a 28-day menstrual cycle, and then on the day 14 is the day she gets to ovulate. So the fertile window is 5 days before the ovulation day and on the day of ovulation. So
Okay.
altogether
Wow.
6 days, yes.
Mm.
So 5 days before and then on the day of ovulation is termed as a fertile window. So for couples who are trying to conceive, it's expected that you try to know this period and as much as possible have regular sexual intercourse.
So
Yes.
what if, for instance, she has tried, we have this ovulation tracker. Some people will
Yeah.
even track, they'll say, I track my ovulation, I'm ovulating today. So what if for a woman that actually does not ovulate, maybe day 14, maybe she has tracked her cycle, she sees that she ovulates maybe day 15 or day 16. Does this also, the 5 days before this, does it work for her too?
Yes, it does. It
Okay,
does. Yes.
okay,
So the
okay.
reason why it's a range per se, yes, that's why.
Okay, so it means
Yes.
that so that means the sperm can actually stay.
Can survive within the
Oh, I
reproductive
see.
tract. Yes.
Okay, wow,
It has
wow,
been beautifully designed for
wow, wow. So it means
that.
that the sperm can actually stay for about 3 to 5 days in a
Yeah.
woman's reproductive system. So for instance, like Dr. Faith has mentioned to us, if you know about the time you're ovulating, about 5 days. So it should just be saying averagely between 12 to 16 days or between
Yes.
11 to 16 days is a safe time for you to
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 have
meet, and
regular.
then hopefully the sperm could heat up. And that's if your tubes are patent, because
Yes.
we might
Very
be
important.
looking at that. Because yes, are there some investigations that you would actually recommend people that are trying to conceive, while trying to conceive, to check whether what they're even trying is actually valid, whether they should continue trying? Are there some things that they should do while, okay, I'm coming to you for the first time, we've been trying.
Yeah.
Let's say we've been trying, less than 30, we've been trying for 6 months, and they come to you for the first time. We've been trying for 6 months, I've not gotten pregnant. And maybe she'll tell you that previously, if I got married, I've been pregnant before, I terminated and all that. And then now, we're dealing with this. What are possible things that you would actually suggest her and her partner to do while they're trying? Possible investigations that you would recommend for them?
So for blood investigations, because there are different forms of investigation. So
Mm-hmm.
for blood investigations,
Yeah.
we want to first check the female hormones that
Okay.
will do the hormonal profiling, where
Okay.
we check
Mm-hmm.
in for the major hormones that tend to regulate
Yeah.
her menstrual cycle. Then
Mm-hmm.
for the men, we do a seminal fluid analysis.
Okay.
Then to check the patency, that's how open the fallopian
Mm.
tubes are we'll do a hysterosapingiography. That's for the woman.
Okay.
And yes, and then also a hysteroscopy just to check the uterine cavity for anything. Then, of course, other baseline radiological investigations. We want to do a TVS. Okay, so for PMOS, which is polyendocrine metabolic ovarian syndrome,
Yeah.
you get to see the morphology of that
Ovary.
ovaries from a TVS, that's a transvaginal
Scan.
ultrasound
Okay.
scan, yes. And
Okay.
then for the man, all of these investigations are also dependent on the medical history
That they
these
give.
couples tend to. So it's not really cast on so, but
Mm.
by and large, these are baseline investigations that we
Investigations
get to do, yes, while we prepare
for
for
them.
conception, yes.
So viewers, hope we are noting that. So these are some of the investigations while you're trying to conceive. These are possible things. Maybe you've tried and it's not forthcoming. It means that you should see a fertility specialist
Absolutely.
while trying. That's one of the things that needs to be done. And when they are recommending this investigation, don't feel like they are wasting your money. They just
No.
want to find out, since you came because you have a concern. It's
Yeah.
only normal for them to find out what the answers to your questions are, why pregnancy is not happening. And that's why they would recommend all those various investigations for you. Let's even be sure that there's sperm from the
Yeah.
ejaculate of what the man is claiming to be
Yeah.
sperm. Yeah, let's be sure that there's even sperm cell. Let's be sure that they are normal, the count is fine, the structure and all of that is fine for the man. And then for the woman, let's even be sure your tubes are patent.
Yeah.
Let's know if it's to just start the IVF and not and not keep. So at what point? Because now
Yeah.
they've actually met you, and then now you might be seeing their results. At what point would you tell them, we don't think you can continue trying, let's just move forward to maybe assisted reproduction technology? At what point would you recommend that for them?
Okay, amazing. So let me just define what infertility is, because it's dependent on ages, right?
Yeah.
So below 35 years, we define it as regular sexual intercourse between partners,
Mm.
and there's no conception for after trying for a year.
Mm.
Then for over 35 years, that's for the woman,
Yeah.
where you're looking at the age of the woman.
Yeah.
Over 35, trying for 6 months is termed as infertility. So
Yeah.
at what point do we say, okay, let's try other options?
Yeah.
It's sometimes, let me start by saying, some couples may not want to. We can't really put a time frame to it, because some people may not want to try at all.
Mm.
Then if they are from the medical history, investigations, medical history, and we see that there's a presence of chronic medical illnesses that, if they should get pregnant, would pose greater threat to
So,
their own health, because the end goal is to hear the loud cry of a healthy baby and see the white smile of the
yeah.
mother, father, relatives. That's the
Yeah.
end goal. But
Yeah.
if pregnancy, we having done all our evaluations,
Yeah.
and they have a medical condition, and we see that getting pregnant may just worsen such cases, we would want to recommend assisted reproductive technology
Technology.
techniques rather.
Yeah.
That's one. Then another thing is, there are different forms of assisted reproductive technologies. I believe we've discussed over in this program. So there's the intrauterine insemination. There's even just trying to stimulate the woman to ovulate, which we call ovulation induction.
Induction.
If several techniques have been tried and they tend to fail, we want to recommend the IVF eventually. Yes.
Okay, so for a woman that outrightly you're seeing for the first time, and by the time you do your further investigation,
Yeah.
it shows that her tubes, for instance, are blocked,
Yeah.
or her husband's sperm is severe low sperm count.
Yeah.
What would be your counsel to her outrightly? Because sometimes I know that some people might be in denial,
Yeah.
but the fact they're in denial doesn't mean that you won't let them know what their options are, and then
Sure that.
allow them decide for themselves if they want to keep waiting for the tube to get unblocked. But yes, what would be your counsel to them outrightly at that point, if you are discovering this when they are coming for the first time, when they've actually tried for about 6 months or even 3 months, and then they
Yeah.
just came? Yeah.
It's always a hard place to be, where you have
Mm.
to tell people that, okay, you cannot carry your baby, or we need to assist you to conceive. It's always a hard place to be. But then it's important to know that for spontaneous, that is unaided conception to
Yeah.
occur,
Yeah.
a woman has to have open tubes, that's
Yeah.
patent tubes.
Yeah. Yeah.
So, like the scenario you cited where she has blocked tubes, and
Yes.
then for the man, of course, we've established that for pregnancy to occur, it's teamwork. The
Yes.
man, the woman, the man has to
Exactly.
give a healthy sperm,
Yeah.
and the
Yeah.
woman has to give a healthy ovum.
Yeah.
Her
Yeah.
tubes ought to be patent,
Mm-hmm.
right? But in this case, we're having a very low sperm count from the man, and
Yeah.
then the woman's tubes are blocked. It's to
Yes.
explain all of this and
To
let her
them.
know that, okay, that these conditions exist doesn't mean you cannot conceive. Beautifully, medicine has evolved, and we have solutions to situations like this. So
Yeah.
yes, we'll put it forward to them that these are the possibilities, and in vitro fertilization, which is IVF, is the
The
best
best
bet
bet for
for
them.
them to hold their babies in their
Babies.
hands. Yes.
So hope we're noting that. So regardless of your age or regardless of how you've tried, if for instance you've even tried for 1 month and you eventually come to see a doctor and they recommend investigations and the findings are saying blocked tubes, it's automatic IVF because
Yeah.
that's the point where the sperm and the egg are supposed to meet at the
Yeah.
tube. So if they're not able to meet, it means there's no way conception is happening.
Yeah.
Yes, we know that divine intervention happens. Some people, it could automatically just get
Yeah,
unblocked, depending
absolutely.
on what also is blocking the tubes. But sometimes when you have these results, you really don't have to stay so long. And then,
Yeah.
the funny thing, you have people that they've actually told them of this diagnosis and they are still in denial, even when they've preferred to them the solution and the way forward. I know that there's a point for money to talk, but there are some that if they really set their mind to do it, it won't be so much of a challenge. But just because of the wrong notion that a lot of people
Yes.
have with
Yes.
respect to IVF,
Yeah.
they struggle to come to terms with the fact that they feel like so it's not happening inside the woman, so it means it's wrong. But
Yeah.
it's not right because imagine that probably for a woman young now, she's 25 and they've told her tubes are blocked. And then they are taking all forms of herbal concussion that the tubes will be unblocked. Then she keeps trying and time is going down. And then eventually she is now trying to come. We know sometimes when reality dawns on these people,
Yeah.
they've
Past
aged
time. Yeah.
exactly, time has gone. And then when she's now coming to the point of accepting, they're now telling her, sorry, your eggs are poor, you have to use donor egg. And then the funny thing is, no matter how the sperm is, if it's there are still some of the sperm that can still be manageable. So it means that the man might still stand a chance to be able to be
Oh,
genetically
yeah.
connected to the child. But now the woman will have to struggle with the fact that she might have to go donor egg, and going with donor egg, it means that her genetic connection with the child will be very minimal. Because even though it's donor egg, as long as she carries the pregnancy,
Yeah.
there's still some form of exchange. So viewers, you can see what time can actually do to
Yeah.
people when you keep waiting, when you keep delaying.
The earlier
And
better.
that's what Dr. Faith has let us know that once you are giving these options at the table, as much as it's difficult,
Yeah.
the first thing is for you to actually come to terms with it.
Yeah.
If you come to terms with it, it means that you're just a step away from getting your solution.
Yeah.
Unlike if you are still struggling, it means we don't know when you would eventually
Yeah.
come to terms with it. So now you know that we have some medications that people will say they want to take. Take this one, it helped me when I was struggling. Take this one, it helped me. Should people just continue to consume medications while trying to conceive, regardless of seeing a doctor? Like, can they just on their own be taking supplements without seeing a doctor and just assume that these are pre, they have the name, they call them preconception, maybe
Pills
something,
and
or medication supplements, probiotics or something, that they have their different names that they call them. Some will say preconception supplements. They are just, I know they have their various names. I'm
yeah.
sure that some viewers can relate. Those of them that actually take these medications. So should they on their own just keep taking these medications without seeing a medical specialist or a fertility specialist just keep taking? How long should they keep taking these supplements while hoping for miracles to happen, and then before they
I,
seek for
I
attention?
think you know my answer already. The
Well,
answer will be outrightly no, because the practice of medicine is individualized.
mhm,
You don't feel like because this person is taking this, I should take it. Now, about preconception care, right? We certain things are done. We try to evaluate this person,
mhm,
the medical history, what in cases where there are disorders that run in their families, genetic
mm,
disorders. All of these are looked into under preconception care. So before we even come into the place of okay, these are the supplements you should take, other things are looked into
into,
consideration.
oh,
There
I
are some
see.
persons that are predisposed to coming down with deficiencies in calcium, in iron, in iodine for those that vitamin D and all of that. So
Yeah,
those when we evaluate such, we
yes,
will recommend the appropriate medications and
medications.
supplements they should take. So imagine someone who has a thyroid disorder and is just on folic acid, is not looking into the iodine aspect,
Mm,
and other supplements for thyroid hormones.
yeah,
Is just wasting his time or her
it's
time rather.
true.
So
Mm,
proper evaluation ought to be done on individuals before taking in medications, even if you consider them as just supplements. Yes, please.
supplements. Wow. So that's very interesting to know. That's very, very interesting to know. And that's why you can really not overplay or downplay the essence and importance of evaluations
Yeah,
while trying to conceive. You don't just assume things. You have to make sure you seek help from the right source, and
yeah,
then be properly evaluated. So that even if they are placing your medication, they are placing you based on that. It's a very important thing that Dr. Faith talked about, something about thyroid. When people have thyroid issues, it has to be addressed
yeah,
before they even try to consider conception, because it can actually prevent even conception
yeah,
from happening, or even cause miscarriage conception to
yeah,
even happen. And that's why it's very essential while you are this to actually seek help early.
yeah.
So, well, as we wrap up on this show today, what's your counsel to people generally that are trying to conceive with respect to how they live their life and just how they keep at it while trying?
Okay, so first off, for those trying to conceive, all hope is not lost, right? There's so much that can happen within a year. So I
Mm,
know it can get so painful having to see your pregnancy test always coming out negative, but all hope is not lost. There is hope if you can channel that energy to the right things,
yeah.
right? So if a diagnosis has been made about infertility and probable factors that result into that infertility have been told, just do the needful, okay? And generally, maintaining a healthy lifestyle, exercising as much as you can, would go a long way. Maintaining a healthy weight would go a long way. And please, I need to say this: folic acid. We recommend folic acid for every woman of reproductive age, even if it looks like you are very fertile.
Mm,
Please, so long you are within a reproductive age, it's important that you are on folic acid 5 milligrams daily, because like I said earlier, by the time a woman tests positive to being pregnant,
yes.
development has started already in the growing child: the heart, the spinal
Mm,
cord, the brain.
mm.
All of these are already ongoing. So you want to be on folic acid. You want to ensure that you are well nourished and fortified for the growing child.
Thank you
Yes.
so much, Dr. Faith.
Thank you.
That was very, very concise and very precise with respect to this talk today. So, viewers, I know that you've taken a lot of notes on all that Dr. Faith has actually noted in this session today. And I know that for someone trying to conceive, there's a lot that you've taken home from this. You don't just stay and consume medication. You don't just stay and copy what someone else is taking.
Yeah.
Like we talked about on Wednesday, that everybody's fertility journey is different.
Yeah.
It differs. Everybody, even if you're same family, it's peculiar with you. And that's why you don't compare your treatment and start consuming medication. It's as good as drug abuse, because
True that.
you just take and then you don't even know the one that is dealing with your vital organs and all that. So please and please, viewers, we deem this session very important today, so we're able to enlighten you to make the right decisions, to take the right step, to do the right things that would actually help you tailor your fertility journey the right path to be able to achieve pregnancy, which is what I know that you are all looking up to. So for someone out there hoping soon to achieve conception, we hope that you achieve that soon the right way and have a healthy baby, both healthy mother, healthy father, and healthy baby. We hope so. Thank you so much, Dr. Faith.
Thank
We
you
have a
for
good
having
we had a
me.
good time with you today.
Thank you.
Viewers, it's Friday. We hope that you enjoy the rest of your weekend. But for now, we'll say bye.